understand. All right, so let's get into treatment situations. Okay, so treatment. Okay, so let me first talk about because I think a lot of people get this wrong, and it's not your fault if this has happened to you, because you're doing the best you can. I just think a lot of people are misled when it comes to treatment with complex spinal conditions and distortions and disc injuries. Okay, so I think there should be different stages of treatment and different goals for each stage of treatment based on the presentation of where the patient is in their clinical picture. Okay, so if there's a lot of pain, so if there's a lot of pain and a lot of inflammation, the first stage of care in treatment should be to reduce the pain and reduce the inflammation. Okay, so again, I'm not giving specifics yet, just generalization. So the first stage should be to reduce the pain. Okay, once the pain begins to subside and the person is able to function better, then it starts to get into some mobility, functional abilities type of exercises and goals. Okay, so start to improve mobility of the spine and the body. Okay, then I will get into, as you're doing that, then I'll get into the global spinal corrections. Okay, global spinal corrections, and then get into the stabilization. Okay, so stabilization will be the core exercises and lumbar stability and abdominal strengthening exercises to stabilize the spine. Okay, so that's the way I would do it. Okay, that's the way I would generalize. Okay, now every person will be at different stages. Okay, doesn't matter if the injury is the same, and some people may jump around from stage to stage. Okay, it's possible, but mostly have to start off with at least reducing the pain and the inflammation. Okay, so what I mean by jumping around is that some people may reduce their pain immediately within the first week of treatment and start getting into some structural corrective care, postural corrective care, and exercises, where others may actually have to prolong the pain relief and anti-inflammatory stage of care for weeks and weeks before any corrective stuff can be done with their spine. Okay, so but at least those should be covered. Okay, so what are the options, okay, for treatment? So there's chiropractic. So you all know I'm a corrective care chiropractor, so I'm a chiropractor. So it's chiropractic. There is physical therapy or physiotherapy. Okay, there's acupuncture, right? There's a soft tissue treatment like massage, and then there's medications and injections, and then there's of course surgery. Okay, so that's kind of the spectrum. Okay, so when you think of the different treatment options, you have to think about what the treatment disciplines focus on, right? So what is the objective of the treatment? First, I want to say all these options, okay, most people want to avoid surgery, right? We know that. Most people want to avoid surgery. I understand that, right? So surgery, in my opinion, should be the last resort. There are times that people need surgery. We've had patients of ours that ended up in surgery. There are times that people need it. I'll kind of talk about some of that in a moment. So put that aside. So surgery is let's keep it as a last resort if necessary. All the other ones besides surgery, they're all good. They're all good. They all have a purpose, right? I don't knock any treatment options that you want to do or anyone wants to do. Same with my patients. I'm a chiropractor, so I focus on spinal corrective work and spinal corrections. Okay. So what you need to ask yourself is, what is the purpose of this treatment? And how do they from what angle do they tackle it from, and what are the outcomes of the treatment? Okay, so I'll give you some examples. So for chiropractic, the purpose is to identify the spinal distortions and correct them and bring it back to normal or close it up to normal. That's the purpose. So it's spinal corrective procedures, whether it's spinal adjustments, whether it's corrective techniques, traction techniques, okay, postural correction techniques. Okay, so that's the objective, right? Physical therapy is going to be more on the using modalities, so laser modalities, ultrasound, muscle stimulation, exercise, rehab, soft tissue work, right? They don't do spinal correction because that's not part of their focus, right? So, and then acupuncture is way different, right? So someone can have a spinal distortion, right, and get acupuncture to relieve the pain and discomfort and balance out the energy channels in their body with acupuncture, and that can get their body to heal, right? But it's not working on the spinal distortion, right? Massage, right? Massage is soft tissue release, breaking down scar tissue, right? Again, that's not going to get the spine to correct if it's distorted. It's going to help with the supporting muscle structures, but not spinal correction, okay? And then, of course, there's medication and injections. So there's always a purpose and a use for medications. Most of my patients want to avoid them. That's what they tell me. Some of them do take it. So as a medical doctor, back up. As a chiropractor, I'm a chiropractor, not a medical doctor. So as a chiropractor, I cannot advise people what to do with medications or what not to do with them. That's up to people to decide that. But all I can say is this, is if there's a spinal distortion irritating those tissues, medications does not fix the spinal distortions, right? It may help biochemically to relieve the pain and the inflammation, the muscle tension, all that stuff, the nerve pain, right? That may help, like the injections may help, but it's not focusing on spinal correction, right? So those are the different options that are available, but they all have a different purpose. They all have a different plan, a different outcome, okay? So when you understand that, then you can now figure out what it is that you want to do and how to use either one of those or all of those, okay? And it's okay to co-manage a patient with different treatment options. So I'll focus on spinal corrective care, but I'll tell the patient, you know what, you may need to see your doctor because we're not getting the results we want within the first few weeks of care. You still have the same pain level. Go to your family doctor, your medical doctor, and ask for any pain management solutions or any, medicine that you may need for that, okay? Or I don't do physical therapy modalities in my office like laser therapy, and I know that can help with the inflammatory phase of care. So if someone still has a lot of pain and inflammation the first 4 weeks of care, I'll say, listen, you might want to try physical therapy or laser therapy in conjunction with what we're doing in our office with spinal corrective care. It doesn't replace the spinal corrective care, but it's something they can add in addition to, or acupuncture, right? With massage, I tell people to wait a bit. Let's get the spine stabilized and corrected before they get into the soft tissue massage work, but we do add that on later on if patients want that, okay? So that's how I tackle the co-management of care and treatment options, either with our patients or what I will tell someone to do, okay? Awesome. So, and then I will talk about surgery in a moment, okay? So one more, when you need surgery, which is what I talked about earlier, but actually, we'll talk about this earlier. So surgery, actually, pause. I'll talk about that in a moment, okay? So someone here asked about Mackenzie's practice. So I think Mackenzie protocol is great. I do talk a little bit about extension exercises in my videos. So that's great. Nothing wrong with that. It's great. And then Stuart McGill's book is, it's a great book on back exercises and low back pain. Great reference for sure. So nothing wrong with that. My philosophy is this: do whatever works, right? If you've been prescribed Mackenzie exercises and it works for you, then do it. If chiropractic's working for you, then do it. If acupuncture is working for you, then do it. If medicine is working for you, then do it. If they're not working for you, then try something different, okay? So pretty simple philosophy. Just always do what works, okay? Okay, so surgery. When is surgery necessary? So we talked about the red flags earlier. Okay, so bladder bowel interruption, nerve compression causing bladder and bowel dysfunction, saddle paresthesia, right? So for sure, if you have those, you have to go to the ER and get surgically consulted for, okay? So other things to consider is let's say someone's been under conservative care for several months and they're really not getting the actual progress in their outcome that they want, okay? So the pain level's the same, the walking problems are the same, the tingling in the legs are the same, and they actually have done something conservatively. Like if you haven't done something conservatively, then you should at least try that, right? But if you're doing conservative things and the symptoms are not changing dramatically, I mean, like they gotta be like 50, 60% better, even 25% better. But if there's only 2, 3, 4, 5% better, then at some point you may need a surgical consultation, okay? What the surgeon will tell you, I have no idea because I don't work at that level. But if someone's not progressing the way we'd want to, then we'll send them to their medical doctor for a neurosurgical consultation, okay?